Special delivery. Want a baby at 65 from DNA editing? Okay, well, we know your answer at any age to having babies later in life. Having a baby, well, the process is different than it used to be. There are a lot more options out there. Coming up, we're sitting down with Dr. Thompson to discuss some of the possibilities for would-be mothers. In your Health Watch this morning, from super babies to freezing your eggs, having a baby, well, there are different options out there than there used to be years ago. In today's world, it's confusing to think about all of this. So to break it all down for us, we have brought in our expert, Dr. Thompson from Central Phoenix Obstetrics and Gynecology. It is great to see you as always. Let's start at the beginning. I mean, we're seeing, and it makes news when somebody of the age of 65 years old is able to conceive and carry a pregnancy to term. How is that possible?
So the first thing to know is not your usual process of making this baby. And we have technologies now that allow us to create embryos outside of the body. And so we can also use different combinations. So back in the old days, you had to use your egg and your partner's sperm. Well, these days you can have a donor egg.
Okay.
You can have donor sperm, and they can be connected outside of the body and then placed inside the body.
Okay.
We also have the advantage of hormones, which can do amazing things to prepare a woman's body to have a baby naturally or from your doctor's prescription.
So once someone has gone into menopause, is there a way with hormonal additions to undo that, to get you ready for pregnancy?
Absolutely.
Wow.
And so the surprising thing is that the process is not all that different from a 24-year-old.
Okay.
So there's a hormone sort of cocktail that you need to do, a combination of injections and pills and so on. But a young woman and an older woman can take that cocktail and get ready, prepare her uterus for carrying a pregnancy.
Freezing your eggs is a big topic, and many women feel like, you know, they have regrets later in life that maybe their doctors didn't talk to them in their 20s when they're in their prime fertility time of thinking about freezing your eggs. So I went through some unsuccessful fertility treatments. I often thought, oh, I wish they would have told me about this earlier. But at that point, you really never know, and you never know really if that would have made a difference anyways. You don't know your quality of eggs until maybe it's too late.
Yeah, the good news is that this technology exists now. And so for many women in different circumstances, women who are facing chemotherapy, women whose family might have had an early menopause, or like you described, the woman who is busy with her career and getting herself financially sound.
Wants the option later.
Wants the option later on. And so the good news is that now we have this technology, but you're right, it's limited. Because when you're 24, you're not thinking about the babies you might want at 34. And so it's difficult to figure out just when is the right time to think about doing something.
Is there still no simple test to know whether you are, you know, set for optimal fertility?
Yeah, there's a combination of tests. You're right, the word simple is key. There's no simple test. There are some things we can do to look at what we call your ovarian reserve. However, the biggest issue is there's no point in planning for a baby you're not ready for.
Right.
And so when a woman is 25, 28, 22, she might not be ready for children. And so there's no point in making a plan, or frankly, lots of times no money.
Yeah, well,
because
very
all these
expensive.
things do have costs. They're very expensive.
And they're talking to you about birth control rather than family planning down the road.
Absolutely.
There are other conditions that can really compromise your fertility too, like endometriosis and various factors that maybe those conversations would come up in the doctor's office.
Yeah, definitely. We want to talk in reproductive health. We talk about the reproductive life plan, about preconception counseling, and so these are things that we bring up even when a woman is very young to help her start thinking about what kind of family would you want down the road. And so to put in her mind, fertility for women is not a lifelong event. It sort of ends at menopause, and so to think about it early on.
And Dr. Thompson, they're telling me we're out of time, but just very quickly, can you touch on this designer baby concept? What does that mean?
Oh boy, that's a huge topic for another day. We now have a quick, easy, and relatively cheap way to design your genes, to really edit out issues and mutations that might be there. So for the future, not that far from now, we may be able to pick blue eyes or brown eyes, tall or short. Yeah.
But ideally to make sure that you're not going to have health risks down the road, right?
It's the best way to look at it.
Dr. Thompson, thank you so much. Great to see you. We want to head on over to Gina. Always interesting to talk with her. I've got dozens more questions.